Welcome everybody. We're glad you're here today, and we welcome you to today's regional COVID-19 virtual open forum. I'm Nancy Miller with Superior Health Quality Alliance, along with my Minnesota colleagues, Janelle Shearer, Jerry Hineker, and Jenna Kornberg. The purpose of today's call is to provide a venue for networking and for sharing information about COVID-19 concerns across all healthcare settings. Just as a quick reminder, excuse me, I'll give you a little bit information about Superior Health Quality Alliance for those who aren't familiar. It's an organization formed with 8 healthcare organizations across 6 states, including the 3 QIOs from Minnesota, Wisconsin, and Michigan. And we're working to achieve broad national CMS quality strategic aims. Our goal is really to collaboratively improve the quality of health and healthcare for consumers, patients, clinicians, organizations, and communities we serve. Just a couple reminders to please mute yourself when you're not speaking, and remember to unmute yourself. And it would be really helpful if you would just state your name and your organization when participating. You can participate either by phone, by pressing *6 to unmute yourself, or just by unmuting yourself in on the lower left corner. Again, a reminder not to disclose PHI. And if you have any problems with Zoom, just message Jenna Kornberg in the chat box and she'll help you out. If you have any other questions or comments, please chat them to everybody so that we can all see what you have to say. Just a reminder again, to help us foster a positive learning environment, when asking questions or comments, remember that we're all here to learn from each other. This is an open sharing call. We're open to anything that you have of interest regarding COVID-19. These are just some starter questions that we thought we would put out there so that you can address any of them, not in any particular order. And we would like to just see where the conversation goes. If, for example, there's a lot of interest in how to address staff hesitancy and it goes in that direction, that's just fine. But these are some questions that we thought we'd put out there as a place to start, and then we'll open it up for comments and give and take. You can unmute yourself, or you can put your questions in chat and we'll address it that way. I am going to stop sharing this now. Actually, I'll just remind you of the questions, and then I'll put the questions in chat so that they're there. But again, we want this to be meaningful to you, and so wherever the discussion goes, and whatever you can do to support your colleagues, asking questions, sharing information is what we're looking for today. So the first one is, really, what are your biggest challenges? What's keeping you up at night regarding COVID in your environment? The second question is, has your organization started offering vaccines to your healthcare providers and or patients, or if you're in a nursing home or long-term care facility, to your residents? And if so, what has been your experience? We're interested in both positive and negative. And if you've had one clinic or one dose that has been administered, when is your next one? And what are you learning from the first one to the second one? We'd like to talk about staff hesitancy or hesitancy among those who really should be taking the vaccine. And if someone doesn't want to accept the vaccine, what is your approach? And what is your process for administering the vaccine to staff, to residents, and to patients? And finally, what is your approach to vaccine education? So those are questions that we think are the most pressing in people's minds right now. I will put those questions in chat and we will open it up Okay, well, since we're not going anywhere specific, let me just ask the first one. What is your biggest challenge regarding COVID right now?
Well, this is Mary Thur, and I'm on the Superior Health Quality Alliance Committee and Board, and I represent Lakewood Health System in Staples. And I think one of the interesting things that we have done, being in central Minnesota, not knowing what the weather's going to do, is we've purchased a fishing, what is it called? A fish house. And we have it in 2 of our locations at our clinics. And so for people who are hesitant to come in to our facility to have their vaccines, they drive up, identify themselves, show identification, and then a nurse comes out and administers the vaccine into their arm, and then they go to the parking lot, wait 15 minutes. If they have any reaction, they honk their horn. If they don't, at the end of 15 minutes, they drive off. Our residents and our community is absolutely loving that. And it's working really, really well. And we can do, a couple hundred in a day because we've got a little path for them to drive through. And I think that was pretty innovative for our staff.
Mary, thank you for sharing that. Honestly, that's the most creative solution I have ever heard. From everybody I've talked to in the last few weeks, I've never heard anything quite so innovative. Thank you for sharing that. And what has been, is that for your patients or for your staff or residents? Who is that targeted to?
Well, the staff uses it, but mostly residents. They have a different process. We have assisted living and care centers, and they're vaccinated on site. But we've been able to open up to our community who go on a waiting list. And with all the changes in Minnesota on how you're able to be vaccinated and have to drive to a regional center, we have a lot of family members who aren't able to get the vaccine, where we're on a waiting list, and then they call, and it's usually 2 or 3 days, and they have a specific time and a place to go. So that's working well.
Wow, that's amazing. Thank you very much for sharing with us. Anybody else on the call that has would be willing to share your process for administering vaccines? I'm not sure anybody else could beat that one in terms of creativity.
This is Debbie Bowe from Midwest Kidney Network. We oversee 5 states, and like she said, Minnesota is very progressive. And as of a week ago, or 2 weeks ago, Friday, they are sending vaccine directly into every dialysis unit in Minnesota. It was the first in the nation, and they ended up vaccinating their staff and then all their patients. One thing that we found with that, it's great having them get that, but a fair amount of our patients do live in nursing homes, so not wanting to duplicate efforts. So we're trying to get a form together to make sure they do send a form back and forth regarding COVID status, and we're just adding the vaccine piece to it, the type, and just to make sure it is registered. Also, I'm not sure, I know the dialysis side where we report it, but I'm not sure the nursing home side where they report it. If there's a database we could just go to directly to double check to make sure they're not getting 2 vaccines.
Mm-hmm. Have you found any instance where you have vaccines that are doses that are left over and you want them to be administered and not wasted? And if so, what have you done with those doses to make sure that they get in arms?
Yeah, we're not directly in the units, but the 2 large dialysis organizations, Fresenius and DaVita, have been allocating between their units. So if there's doses left over in one unit, it goes to another one of their units. I don't know if they've opened it up. It would be great for, family members or, the drivers that bring the patients in, the transportation companies, anyone that comes into the unit to, vaccinate those people. But I have not heard that they've done that. But I know within their own large dialysis organizations, they do move any excess vaccine to another sister clinic.
So just to follow up to that, Deborah, if somebody gets a vaccine, because you don't want to waste doses, of course,
Right.
and they're not necessarily part of the cohort that you originally intended it for, do you give them a card or some way to document that they had gotten that? And then how do you make sure that they have accessibility and that they sign up for their second dose?
I wish I knew that. I know within the large dialysis organizations, they are saving vaccine to make sure that the second dose is given and that it's the same vaccine. But I do not know about cards. I know in some of the states, they do have vaccine cards, but for those patients, I do not know if they distributed cards. I know there's a general card out there that the health department uses. And I would hope that they would use something similar. Our concern was the nursing home population because they don't always have a place to put a card or may not, carry it on them, bring it with them. So we could double check to make sure, that they received, not that they got the COVID vaccine versus just a flu shot. So if anyone could steer me in the right direction, I'm not sure nursing home wise where they report that. Is that just reported in the local health department? And is that easily viewed or how is that tracked? I don't know that piece.
Hey, Debbie, this is Jerry. Yeah, I just put this in chat. I thought that in Minnesota, all of the COVID vaccines were being recorded in MEC. And that's how they could double check.
Okay.
I thought. And
Jerry, do you want to let others know what MIC is?
Okay, now you're going to make sure that I know what every letter stands for, but it's the Minnesota Immunization.
It's a registry.
Yeah, it's the registry. I was going to say, I will look it up and because I knew you were going to ask me that, and I just know it's called MIC. So I will.
This is Janelle. It's the Minnesota Immunization Information Connection, so MIIC. So every vaccine is put in there, and I believe all the COVID are as well. So, for example, I've received vaccinations, not COVID yet, but from the clinics, or I've gone to Walgreens, and the immunization is in this central database, so they know.
I'm assuming that Wisconsin and Michigan have something similar. Is from somebody from those states, if you would confirm that. And how does that, are you using the same process that you're registering those vaccinations at their state site?
Hi, can you hear me?
Yes.
Hi, this is Michelle Robertson. I am the infection control nurse at Marlette Regional Hospital, which is a small rural critical access hospital.
In what state?
Michigan. Okay. And I just took this position about 3 weeks ago, so I am brand new. But we have been administering our vaccines. We've been having trouble with getting more supply. We do register them with what, for Michigan, it's called MICR. And that's the, the immunization tracking. When we have been holding clinics and vaccinating our staff and the community when we have the availability, and then we automatically schedule them for the second dose at that time. We have some, hopefully some Pfizer doses coming in, and we are working with our health department and with our doses. So we are reaching out to the local schools and then the fire departments as well to try and get them vaccinated as well. And I got my second dose yesterday, so.
Oh, how wonderful. That's great. Thank you for sharing that. And Elena Smith put in the chat that MICR is the Michigan Care Improvement Registry. So that's the equivalent. How about somebody from Wisconsin? Wisconsin is WIR. Tracy, would you unmute yourself and let us know how that is it a similar process?
Sure. Yeah, Wisconsin has the same type of registry, the Wisconsin Immunization Registry, and all vaccines are documented there.
So to all of you who just spoke, I'm assuming, and please confirm, it's tied to the person, it's the date, it's the dosage, it's the type, and then the second dose. Is that correct?
correct.
Okay. It seemed like somebody was ready to jump in earlier and wanted to say something, and I can't remember who that was. But we've been talking about the actual administration of the vaccine in your facility, in your clinic, in your hospital, whatever care setting that you're at. What are some of the challenges you have, either logistic wise, working with a partner like CVS or Walgreens or other pharmacy? What have you had in terms of hesitancy? Just what have you learned from the first dose to the second dose? So at the bottom, go ahead.
This is Sarah Jordan with ABF Home Health Services in Michigan. I'll just kind of jump in a little bit here. In Michigan, we have a regional coalition for the state, and it's all broken down according to where you live for your agency, and it's an emergency preparedness team. And so through that regional coalition, we were able to get scheduled through the local health department, depending on what county or what region, what part of the state you were in. So initially they gave us time slots to get the first vaccine, and that went pretty smoothly initially. Then they kind of opened it up more, and it became very chaotic to getting the vaccine. Then the health department said, well, you have to call and schedule an appointment, and nobody was able to get through on the phone lines. So they were just showing up. So it was a little bit chaotic. And then subsequently to that, we had issues with second doses, which we're still kind of experiencing. So if you were calling for a second dose, it was difficult to get through. It was difficult to get scheduled. And then at some point they didn't have any vaccines. So there have been some challenges. I think it's a little bit better right now. I'm not exactly sure about that, but we did give our home health nurses and caregivers the opportunity to go through that process. And most of them have been completing that process with a few challenges, but then we have a group text that we use, and they update how their experience was, if they had any symptoms post the injection. And it's kind of like an open forum, so people can kind of stay encouraged. If somebody has an issue, another person might say, hey, I got my second dose, it was no issue. Just make sure you call first. Or if they say don't call first, just make sure the vaccines are on hand. You know, it's been a guide map for all of us to communicate on one forum, which sort of helps keep all of the caregivers encouraged. Some of our nurses have had access to it through other jobs, like through their hospital that they work for. Myself, I'm a chaplain, so I got it through the fire department. And then I'm scheduled to get second dose next week. So that was a little bit smoother because they had a concise process. But as far as the home health, we did it through the regional health department through that coalition.
Well, that's a great idea that you just shared, Sarah, that you have a kind of it sounds like almost a group chat so that you can share with each other all the information relevant to the vaccine. Is that correct?
Yes, that is correct.
Okay.
We have that set up already. Like if we need to discuss patient files, it's all secure. So we just did that, and everyone was able to keep an update and stay encouraged, and it helps us to really work through those issues as they arise. It's a little bit quieter right now, so I'm assuming that things are going better, or that the team that wanted to get vaccinated is circling through their second doses now.
So if there is a shortage of dosage, do they save some for the second dose, or are those people kind of first in line to get their second dose as they come in?
Well, that's a good question. I'm not exactly sure what their process is from the health department, but they do have, I mean, obviously they've well documented who is scheduled for that second dose. So you should be able to get priority. I haven't heard where it's been a long-term issue, but I don't exactly know their process, so I can't speak on that directly. However, if you had the first dose, I think you have to get the second, preferably within 3 weeks. They don't want you to wait too much longer than that. So those clinicians and professionals are aware of that. So they're doing their best to take care of those people first. I know there was a little bit of a shortage, so they kind of filtered through their list. But as far as how they operated on their end from the health department, I'm not exactly sure.
One thing I could share really quickly, my name is Elena Smith. I am also with Superior Health. Yesterday, the Advisory Committee on Immunization Practices, which is the group of care providers that kind of make some of these guidelines that push out to the states to kind of, then the states decide what they're actually going to follow and all of that. They had a call yesterday that I attended, and they did make a comment on some of the things you're just talking about regarding the second dose. So I'm reading this directly off their slide. The second dose should be administered as close to the recommended interval as possible. However, if it is not feasible to adhere to the recommended interval, the second dose of Pfizer and Moderna COVID-19 vaccines may be scheduled for administration up to 6 weeks or 42 days after the first dose. So if you do have any staff members that are having difficulty with that second dose, you can kind of remind them of some of that information. I'll put that right in the chat in case you want to steal any of that little verbiage. But that is directly from kind of the people that help make these recommendations that we're all following right now. But that can help hopefully kind of ease some people's frustrations with this. I know that everyone's just trying to do the best they can with scheduling everyone's vaccines, and this has been a difficulty across the whole country, but this is something that just came out yesterday that I will share with all of you in the chat.
Thank you, Elena. We really appreciate that follow-up. This is just excellent conversation of sharing with each other. I'm sure we're all learning something today. Eleanor's put in the chat, we've been using CDC talking points for staff and patients to answer their questions. We've utilized the school and the Boys and Girls Club for vaccine clinics. And then Elena just put in the chat the recommendation on when the second dose should be administered. And again, some good talking points, because I'm assuming that people are concerned about getting their second dose, within the recommended time frame. But it's helpful to know that there's a little bit of wiggle room, if you will, in terms of timing of that second dose. So that's helpful to know. So thank you for that, Elena.
I can share one other piece of information that came out of that call that I thought was pretty new and you might be kind of trying to figure out this question yourselves. So we know that these two vaccines that we currently have right now are not interchangeable, but there can be times where you will have no idea what vaccine a patient got the first time. There are a lot of suggestions that they're asking you take before just guessing, like always asking your patient to take a picture of that vaccine form if you're filling that out that says what vaccine you got. There are a lot of different recommendations that they have for that. I'll try to find some of them and put them in the chat. But they do say in the exceptional situation in which the first dose vaccine product cannot be determined or is no longer available, any available mRNA COVID-19 vaccine may be administered at a minimum interval of 28 days between doses. So again, that 28 days is because that Moderna one is that longer time period in between doses, but that's the recommendation. Again, it's not a best practice. It's just if you've exhausted all other ways to check and see what vaccine a patient has had, that is what they suggest you do.
Well, let me ask you this, because I have not had the vaccine, but we were talking earlier about the card that you get. Is not the type of vaccine put on that card? Can anybody answer that question? Then there wouldn't have to be any guessing. I mean, understand that if one isn't available, under certain circumstances, you might be able to substitute as long as it's the same mRNA vaccine. But there shouldn't have to be guessing. So I'm wondering if anybody knows if on the card that you get when you have the vaccine is the type of vaccine listed.
This is Lisa from, hi everybody. I am a consultant at Stratus Health, and anytime you do a vaccine administration in a clinic or wherever, you always have to write the lot and the dose number and everything like that. And even when vaccines are administered at public health, they do give the customer a card with that lot and dose. So it's standard of care.
Okay. Yeah, so Michelle Robertson did say they put the type of vaccine on the card that they give out. So that's helpful to know. I was just curious why somebody wouldn't know what type but maybe they lost the card or what. I'm trying to figure out logistically how somebody wouldn't.
Unless they open a lot of tattoo shops and put it on everybody's bodies.
Yep. Can I just ask Lisa, would that not also the type of vaccine be recorded either in the MIC or in the Wisconsin and Michigan registries when they're recording the vaccines?
Yes, they have to do all parts of it. So the manufacturer date, I mean, there's a bunch of information. You all, as clinicians, you probably all know that.
So you should be able to find it there.
Okay.
Yep. In the registry.
That's good to know. Okay. What other challenges have you run into either getting people to logistically or getting people that really should be having the vaccine and have the hesitancy issue? What other issues are you having that you either want to share that you overcome those issues or you found a solution to them, or that you want to open it up for feedback from others on the call? Or we can just broaden the question. What is your experience of the vaccination process that you think it would be helpful to others as a kind of a lesson learned, or something that worked really, really well, something that didn't work so well, and that you're going to make a change going forward?
Nancy, I could give some comments from a meeting I went to the other day. I'm Barb Link. I'm with Superior Health as well, and I'm out of Michigan. I went to a hospital system run collaborative the other day. And so it was the hospital system along with their skilled nursing facility partners. And they asked the same question of the partners at the meeting. And so this was in Southeast Michigan in the greater Detroit area. And I thought some of these things, I'll talk a little bit about challenges they said, and then things that went well. So they were skilled nursing facilities and they had received the vaccine from the two major pharmacies here in Michigan. One skilled nursing facility received them from Walgreens and the other one from CVS. Both of them said they felt that it went very well. They were very happy. I don't know how comfortable, I guess it's just aggregate information that they were very happy with both of the pharmacy companies. Just a little tweak with Walgreens. They wanted all of the consent forms ahead of time for staff as well as residents at the particular nursing home, and that they really wanted times and have the exact amount of doses that they distributed at the clinic that they held at the particular nursing home. CVS was willing to have it a little bit more open-ended where they wanted all the consent ahead of time. They wanted appointments, but if there were some extra doses for cancellations or whatever, they were willing to have walk-ins on that day as well. So I thought that was just a little difference in the two companies. Maybe it's changed as time has gone on, but that was their initial impression, that they had just two different, just a little tweak. The one, I thought this was just interesting as well. One of the skilled nursing facilities had a rehab unit. So then they would have participants who were short-term stay, and they would come in for rehab and leave. I thought this was a nice thing. So for those short-term stay residents, they did have a clinic for them. And if they were discharged during that time period between the first and second dose, they were willing to set up another clinic to have those discharged patients come back and receive the second dose. So I thought that was sort of a nice best practice to think about. If you have a short-term stay unit at your skilled nursing facility, what a nice community service to do for those people who are discharged, to have that second dose available for them to come back and get that at your facility. So just some comments about people experiences that they had in Michigan here.
Thank you, Barb. And in the same vein, I'm working with some nursing homes in an echo call around COVID out of New Jersey. So I've been learning what some of the things that they've been doing, and I'll just share those with you as well, because the more we know what others are doing, the more ideas that we get for ourselves. Some of the lessons learned that they have is that just the logistics. In some cases, these are long-term care or nursing homes. Some just literally went down the wing, with their partners, CVS or Walgreens, and that was very efficient. Others went by a last name, alphabetical, so that it would be really, really crisp and clear. In almost every case, they would pre-fill the forms so that there wouldn't be any lag time when people came to get their vaccines. Everything would be set up ahead of time, and then they just signed on the spot or whatever. So that, again, is a best practice that's been fairly uniformly adopted. Another thing that we've been learning is just kind of the, even though intrinsic motivation is the best way to take the vaccine, because you're doing it because it's the right thing to do for you, rather than from a reward standpoint, an external reward. They do recognize, a lot of people are recognizing, facilities are recognizing those who take it, either by having a photo booth or taking a picture of somebody when they give out buttons. I'm a big shot. Some have given out Beanie Babies. Others have given out T-shirts, or any other way just to recognize the people who took it upon themselves to get the vaccine, because not everybody is doing it. There's still a lot of fear out there. People aren't being pressured, but they have talking points. Mm-hmm. And they have found that even though they give out information in staff meetings or town hall types of forums, the best way to communicate is one-on-one. So people have their individual fears or reasons why they don't want to get it, but not from the standpoint of talking them into it per se, but just to answer their questions so that they feel more comfortable. So I would share that, and I'd really love to hear from others what you've done in terms of process that you think has worked really well that you'd like to share, or some ways of recognizing staff, residents, patients, and others who have gotten the vaccine, so that others might be a little bit more motivated to get it as well.
Can I just take a question onto your question, Nancy, too, with the staff or even a resident or patient hesitancy? I was just wondering, for some of those, I'd heard that there was a little bit of a backlog at times in some of the nursing homes or assisted livings or memory care units, because there needs to be consent given by someone other than that resident, if they have Alzheimer's or dementia. And I was just wondering how that process was happening, if there was, was there hesitancy on the part of the family member to consent to having their loved one get the vaccine, and how was that handled, and just even how that whole process was handled? Did they have to come in and sign in person, or is it something you could do, online to get the permission for that vaccine.
We encourage you to speak up, even though you think that you might not have anything to offer. I guarantee you, if you have something to share with your colleagues on this call, it will be beneficial to somebody.
Hello, everyone. Hi, Nancy.
Hey, April.
Hi, Janelle. So I had to jump in and out. I had some staffing issues. So the unfortunate and beauty of the Zoom calls is that it doesn't feel like we're actually in a meeting sometimes, and I still end up getting pulled. So I apologize. I missed a significant amount of the call, but it sounds like the question is what have we done in regards to our vaccines and maybe some workflows that we've done in regards to distributing the vaccine?
Mm-hmm.
Would that be accurate? Okay. Well then, because I like to talk about great things that are happening, I'll just throw out a few things that we've done. We actually had our first community vaccination clinic yesterday, and it was awesome. And the process we did was a little bit different, I think, than maybe some facilities have done, because we know that we only were allotted so many, and I by no means was leading this charge at all, but we did do a lot of outreach. We did outreach calls to our 75 and older population who were high risk, and honed in on very specific population, and pulled the team together and diverted staff into different ways, made outreach phone calls, and scheduled 740 patients for their vaccine yesterday. And from 9 a.m. to 6:30, 7 o'clock p.m., we ran a very efficient COVID vaccine clinic for our community with an outpouring of gratitude and graciousness from that population. And there was a lot of moving parts, but we separated ourselves into different sections. We had the vaccinators, we had the reconstitutors, we had the check-in team, and we utilized a local church, and bless their hearts for allowing us to do that because they had the space. And we had locations for everyone to sit, so they were socially distant and they could sit there 15 to 30 minutes depending on their risk factors. And that went really well. We had some hiccups with the documentation piece and getting that information into MIC, but we'll be hopefully holding many more of these to come.
April, thank you so much for sharing. You look like you're just so pleased and such a sigh of relief in your face. I mean, it just shows so much. I am curious, first of all, who did you work with for your pharmacy partner? Secondly, how did you bring this team together, and who was on this team to really figure out all those logistics? Because it sounded like it went off without hitch.
Yes, good questions. So we utilized St. Joseph's in Brainerd for pharmacy.
Okay.
And then, if I remember correctly, yes. And then we've already had, because COVID has made us change the way we think and plan, we have a COVID task force, which includes our infection prevention and our senior leadership team, and then clinic team, and then really navigating through what are the basic workflows that need to happen. And then, just like all good process improvement measures, you start with the basis, you find the ways to do it, then you bridge out into your different teams of them bringing in the patient access team. And I think maybe, did we have 30 staff in the end? Oh gosh, I don't even know. I might even be wrong. It might even be a little bit more than that, but we just broke out into our work groups, took care of the different things that needed to happen, and probably not articulating that very well, but we use process improvement measures of our workflows, which we really live by, that Six Sigma and workflow, and it does nothing but good things for us in multiple different situations.
So how long did you do this planning? I mean, how long did you know that from the time that you knew that these doses were available till you actually, pulled the trigger on your plan? That's one question. And secondly, how long in advance did you have this process in place?
Well, as soon as we were already doing some of it because we were working on our staff population. So we had a very basic workflow already in place that we utilized. It's the staff is notified, they have their appointment time, they come in, they check in, there's someone doing the reconstituting and there's someone doing the vaccination. So we knew that. Then we had the location for everyone to sit, and then they did their 15 or 30 minutes, depending, and then they would leave. So we had the very basic process in place as soon as we heard word that we were going to be able to give vaccines to are in the first phase there. And then we just increased the volume of people needed to work through that. So we had about a week to dive into doing 740 vaccines and making that work. So a lot of time, a lot of effort went into it from multiple different people.
So it sounds like you had the basic process in place, and you just made it scalable once you knew that you had additional vaccines available, doses that you knew who, and how did you decide who to reach out to? Who made that decision? How did you go about deciding, okay, we got these additional vaccines, who should we target?
Well, that would be our COVID task force, which is the offshoot of our incident command. When the pandemic first started, we started our incident command. And so then from that, it's just another layer of the incident command group that just went in with infection control and then senior leaders with that. So I think I answered your question. Maybe I didn't.
Absolutely. Thank you so much for sharing that, April.
Yes, absolutely. I love sharing.
April, this is Janelle. I have one more question for you. You said you targeted 75 and older and high risk. So I'm just wondering, did you target high risk under 75 based on, different comorbidities or health conditions?
Yeah, we did. The incident command group, the COVID task force, looked at who are our highest risk population within our community right now. And we looked at our oncology group, and they were the first ones to get the phone call outreach. And then I don't know all of the logistics of that because I wasn't involved 100% in that, but I do know that we knew the number of patients of vaccines that we had. And we know that we have reports available to us to pull 65 and older. And then you slowly do the digressing of that report to get to a number to be able to fill the slot of the 65 and older of the 700 some vaccines that we received. So there were about 1,800, I believe, on the list that we could reach out to that were 65 and older. And we had a lot of phone calls happening in a very short amount of time. And even we had some no-shows yesterday, and we did last minute outreach from our list. So we had some information prepared in case, and we are awesome, not to brag, but we did not waste any vaccine.
That's
Yes.
fantastic. Thank you. This is so heartwarming to know that.
April, this is Debbie Bo from Midwest Kidney Network. Just a question. I wanted to commend you, the phone calls that you did. I know in Wisconsin, we had a registry through the state health or through the county health department. And to get on the website, you kind of have to look for the site. Once you find the site, then you get a code to your cell phone to get in. Who over 75 or 80 would know how to do that? So phone calls are really the best way to get to that population. Even, you know, in long-term care facilities, they have their way of getting their shot through their facility. But anyone who's living at home who might be in their 80s or 90s even, they don't have cell phones and they don't have laptops. So I commend you on doing the phone calls. I think that's probably the best way to get that population and really important to remember.
Thank you. Yes, absolutely. And I was one of the vaccinators yesterday, and every single person, I don't even know how many people I vaccinated, but every single person was like, I can't believe I got the call. I was so grateful to get the call. The call came, and that was really grateful. And I should mention also that we worked very closely, hand in hand, with public health. And they are a big piece of our planning. And so have to say them too, because we talked very much in detail about how many vaccines they were getting, who were they going to focus on, and who were we going to focus on to reach out to the community.
April, can
go ahead, Jerry.
Oh, I was just going to ask a clarifying question. So this is, if my understanding is correctly, like health systems and public health have all been allotted a certain number of vaccines. So April, these were the vaccines that have been allotted to you. So it's separate from the kind of lottery that Minnesota is now doing for those 65 and older. So your clinic isn't part of those clinics that were set up as part of the, I hate calling it a lottery system because that sounds so horrible, but
yeah,
that's basically what it is. And so again, that's why you were able to call your patients versus having them have to go and look on a website,
yes,
like they have to do for the state. Okay.
Yeah, that's very good. Good clarification. Absolutely. We are not part of the lottery location.
Deborah, thank you so much for your comment and about calling, because you know the target population, as you said, many of them don't have the equipment or the wherewithal or the skills to do what needs to be done to reach out themselves. So the calling was an excellent way of doing that. I'm really curious. There's a question from Tammy. April, how are you planning for second doses for this group?
Well, right now, we're going to keep our fingers crossed that we do get the second dose. And because, you know, in COVID life, nothing's a guarantee, but we will run our process the same way. But what we did to plan ahead was we picked a day already for the second dose in anticipation of what we believe is when we're going to get our second dose allotment, and communicated that to all of the patients, and also saying, you know what, we need you to understand that we may not be able to do it because we might not have it at this time, but on this day of February 17th, this is the time that you would come for your second vaccine. We have a reminder call process set up. Everyone at the time they were called to schedule their appointment, they were informed of this. And then they were also informed of this when they registered that yesterday when they came in. And all of us vaccinators were also re-communicating that because we know we have to hear things more than one time. And so we were restating that. And we have a process of callbacks that will happen, the reminder calls. And we're actually meeting this afternoon to huddle on what works well, what we see that we need to fix, like good process improvement work. So that, yes, so we'll talk about that in solidified plans also, but I think we'll be able to just move up forward with the exact same process we did yesterday.
That's great, and thank you, Tammy, for your follow-up question. I'm curious for those of you on the call today, is anybody else in the same situation that April was, where you had additional doses available that you wanted to not waste? And who did you reach out to, and what was your process for reaching out to those people?
So this is Tammy. Can you hear me?
Yes.
Yeah, so we did have a very similar situation to what April had on a much smaller scale. So we actually kept it right within our facility here in Wadena. But we did reach out to our high risk and over 75. We had about 390 doses that we were able to provide to our very grateful patients. Our this process almost mirrors April's, except that we stayed within our walls. We were fortunate enough to have a couple open large spaces that we could utilize. You know, having a spot for that 15 to 30 minute wait time is challenging. With that being said, it was great joy to experience the gratefulness with the patients. April, I almost got tears in my eyes when you were talking, because that's what we felt as well. They were just so thankful to get the call. But I am also concerned about that next dose. We set up all of our appointments, you know, for 3 weeks out, hoping that we'll get them. But we'll wait and see. And if we have to change them, we'll have to change them. And they're very understanding about it. So.
That's awesome, Tammy.
Yeah.
I love it.
It's great team effort, like you talked about, from access all the way straight through. Mm-hmm. We had the exact same process you described, just within our building. And the patients, we got many compliments on how efficient it was, and callbacks saying thank you. Some of our registration staff and schedulers got flowers sent to them. Just such grateful people.
Yes, I love that.
Yeah.
We have a every week leadership meeting, we call it our COVID meeting. And today, all we could say was, yesterday might have been the greatest day of team collaboration, community effort, the work that every single person put in together. It was like, whoa, why can't this happen every day? Because it was so awesome.
Totally agree.
It's like, wait a second, we have quality measures we need to meet. Can we just take some of these?
Exactly, yeah.
Can we do this right now too? You see all this intervention happening. Come on, people. So we're going to raise the roof here we're going to use our COVID vaccine clinic to say,
we can do it. We can do it.
Oh, you guys are making me tear up. I'm just in awe of what you've done. And I'm sure others on the call are pretty impressed too. Anybody from Wisconsin or Michigan have a similar situation? Deborah says it's been great listening to the stories, especially April's story. And Jerry Heider said, CV Miss are adjuster in our St. Joseph's Hospital in Ann Arbor, Michigan. Our vaccine team developed a will call website. Geraldine, would you say a little bit more about that? A will call, is that kind of a similar situation?
Hi, can you hear me?
Yes.
Okay. Yes, to my understanding that it is a website for people to, tap into for their family members or people they know who are 65 and older, who are sort of in that waiting field. And, it does depend on the supply of the vaccine, unfortunately. I mean, recently I heard, like this week, it's like they're not really taking any names on the will call list because they're waiting to see, where our supply is going to end up. But prior to that, yes, they were successful in, using the vaccines that were about to, expire in 6 hours. They had enough people. I think it was, it wasn't. It was maybe 60 or something, but everybody, like you said, was very grateful and thankful. And so it is very similar to what the other members have shared today.
That's great. It's just anything that you can put out there to have people lined up so that they can come in almost at a moment's notice to take advantage of those vaccine doses so that they don't go to waste. That's just fantastic, whether it's proactive like April and Tammy did, or as you're just mentioning, Geraldine, having that waiting list, if you will. There's just been such great sharing today. Thank you all so much. Before we end, I do want to, let's see. I want to make sure that you know that we have some resources on the Superior Health Quality Alliance website. These are all sorts of really great resources that you can access. The link is in the chat. And it is not just our resources, it's a really nicely curated list. And I do want to put a plug in for the next call, the next regional COVID-19 all care settings call is February 25th at 9 a.m. Central, 10 a.m. Eastern. And the topic is on resilience. So tools and resources to foster resilience in today's environment and strategies to promote resilience. The registration link is there. And Jenna, if you could also put that in the chat. Oh, there it is. So if you want to register for that, we really appreciate it. That's a really great topic. Here are the contacts. If you feel, you can reach out to any one of us at any time and we will get back to you. And we appreciate your attending so much today. There's a couple minutes left. I just wanted to make sure before we ended that you did get a chance to see that the date and the topic of the next session and the link to do so. And thank you all for attending today. I hope that you got something out of it. Really good sharing among yourselves. And we wish you all a very happy and healthy new year and see you next time.